Hi, everyone. You weren't able to have my lecture in person uh, on Monday, and Tuesday you're going to be busy, so I decided to go ahead and do a video for you and on the last half of the PowerPoint. So use your PowerPoints to follow this, okay, and make your notes. Everything in the quiz is going to be from your PowerPoint, and it will have your definitions. It's going to have the abbreviations also. So I want you to use that PowerPoint. Now, we're going to start doing the pathologies. And remember, we in the endocrine, what the endocrine system does, and it secretes hormones into the bloodstream, whereas the exocrine system has ducts and it secretes to the outside, like it says exocrine. Okay, so the exocrine system is your sweat glands. That when we sweat, it it cools our bodies off. Mammary glands, when the mother nurses her baby, the milk comes out of the nipple there at the duct. So that is exocrine. Our endocrine excrete right into the blood. So remember the what I called the captain of the ship was? It's the hypothalamus. The hypothalamus is it tells the pituitary, which is called the master gland, what to do. Now, the pituitary secretes its own hormones, but it tells the other organs what to secrete too. Okay, so the hypothalamus says, "Hey, pituitary, we need more insulin," and so it tells the pituitary says, "Hey, pancreas, uh, secrete the insulins. We need to bring that blood sugar down." So that's what it does. Okay, so the pituitary is the master gland, and it does what the hypothalamus says to do. So remember what the receptor sites were. That's where the hormones. So that was the receiving areas of the hormone. So we're going to start with the pathologies, and acra meant extremity. So the hypermegaly is a type of hyperpituitarism in which an overactive pituitary gland causes abnormal continued growth of bones and tissues of the face and the extremities after adulthood. So these people are they're not formed like a normal person. They are a bit deformed. They're very tall. They're very awkward looking. And this is because of the growth hormone being overactive. So then so you've got acra, and that's extremity. So megaly is large. So remember that, okay? Acra. Addison's disease. We've got about 3 diseases that you need to know. This is the first one, Addison's disease, and it's characterized by gradual adrenal gland failure. Now remember, your adrenal glands were the little hats that sit on top of the kidney, and they result in insufficient production of steroid hormones and the need for HRT. HRT means hormone replacement therapy. So Addison's disease has to do with the adrenal glands. So Addison's disease, adrenal, A. So remember those, how you can put the two together. So then you've got congenital hypothyroidism. This is also called cretinism. And these people are short in stature. The face is abnormal. I don't think they live very long. It's really sad, and they call it an arrested physical and mental development. So everything just stops. And this is a congenital condition of the thyroid. Cushing's disease is the second disease that you need to know. And this is caused by hypersecretion of cortisol by the adrenal gland, resulting in altered fat distribution and muscle weakness. Now, how I can remember about Cushing's disease is the altered fat. So you've got these fat pockets everywhere. So it's like added cushion. So I can remember that Cushing's disease is the fat distribution because they're cushy. Diabetes insipidus. This is not a diabetic disorder. This is it's a urine disorder. It's copious quantities of urine being excreted. This is unrelated to diabetes. Like I said, its symptoms are excessive output of dilute urine. So the urine is like water, color of water, clear. So about 20 quarts of urine a day, or about 19 liters. So normal is like 0.8 liters to 2 liters a day. Now, liters are the Coke bottles. Your Coke bottles come in liter bottles. Okay, so think of that. 19 big bottles of that you would be peeing out. This is a really bad problem. You can die. So you would be put in ICU. Diabetic ketoacidosis is hyperglycemia. So the blood sugar is sky high. This can happen with people who have no idea that they're diabetic, and they go into a coma, and they are tested, and their blood sugars are like 500 or plus. So that is deadly. They have to be put in an ICU and then put on insulin drip. People with diabetes who are non-compliant because they don't want to take their medicine, and they're going to eat anything they want or drink anything they want, and so they can cause themselves to have a DKA, and this is deadly. And so it's a serious problem, and they will be in the ICU. Diabetes mellitus, that is a chronic disease, and so many people we have, it's an epidemic here in the United States, and it's caused by overweight. It can be caused by multiple problems, but this type 2 diabetes is they have found where a lot of overweight people have it. So diabetes mellitus, you have type 1, which is insulin dependent. You have type 2, which is, it can be oral. It can be oral medication. It can be or insulin. And it can be controlled by diet. It depends. If the controlling it by diet doesn't work, then the doctor usually starts you on the oral pills. And then if that doesn't work, they either combine the pills with insulin or put you on insulin. The diabetes is where the insulin is not being secreted by the pancreas. So the pancreas has these cells in it called islets of Langerhans. And the islets of Langerhans has two types of cells. They have beta cells and they have alpha cells. The beta cells, we have a certain number of them. And when they're damaged, they can't secrete the insulin. So then we have diabetes. These do not repair. Once you are diagnosed with diabetes, you always have diabetes. You can have it under control, but you still have diabetes. Dwarfism is a hyposecretion of growth hormone, which is GH, that's the initial or abbreviation, during childhood, resulting in an abnormally small adult. And these adults, their joints can be deformed. Their internal organs are different than ours, and they usually have multiple medical issues. Exophthalmos, exophthalmos, and this is where the eyeballs I'm sure you've seen people with their eyes just like protrude out, and that's what this is called, and it's caused from a thyroid issue. Gestational diabetes. This is the third type of diabetes, and it is temporary. This is the only one that is temporary. I told you we have type 1 and type 2 diabetes. This is gestational, and this is when a pregnant woman is diagnosed with diabetes during pregnancy. She usually has to be on insulin. And then when the baby is born, the baby is usually a larger baby than an average size. An average size baby is like 6 to 8 pounds. These babies are like 10 pounders. So because they've been feeding off the sugar of the mom. And so when the babies are born, they have to be monitored for their blood sugar. Some of them have high blood sugars and they have to be put on insulin for a little bit. And then they have to be monitored so when that blood sugar drops, that they can stop the insulin. It's really difficult, but they do usually even out. Giantism is a type of hyperpituitarism that causes hypersecretion during childhood. Then you have these goiters. Goiters are a growth on the thyroid. The thyroid starts protruding, and this is lack of iodine. It's not producing iodine. So this goiter keeps growing here, and then it impedes your breathing. You have to have the thyroid removed. Oh, and the never mind. So Graves' disease is the third disease. It's a hyperthyroidism caused by an autoimmune response, which causes exophthalmos. So how I remember this is the exophthalmos is like zombies' eyes are out like this, wide open, and they're coming out of the grave. So Graves' disease for the zombies, okay? So that's a good way of remembering it. Hashimoto's thyroiditis is the chronic inflammatory condition that leads to the most common type of thyroiditis. Hirsutism is the male pattern of body hair. So these women, I don't know if you've ever heard of the circus woman, the bearded circus woman. She had a full beard and she had chest hair and she was a woman, but she had this hirsutism. It's hard to say. Hyperaldosteronism is adrenal glands release excessive aldosterone. So the adrenal glands, again, that they sit on top of the kidney. Hyperparathyroidism and hypoparathyroidism. The parathyroid sits on the side. It's the side of the thyroid. So and it secretes PTH, parathyroid hormone. And so it's either hyper or hypo are the two conditions. Myxedema is severe form of hypothyroidism that develops in the older child or adult, not younger children now, not babies, but older child or adult, causing non-pitting edema in connective tissue. So pitting edema is what we look at with congestive heart failure when we look at if they have any edema down in their feet. So we put a finger on it and hold it for a few seconds and lift it and count the seconds it has for the fingerprint to recede. And so so that's pitting edema. This is not pitting. This is it's kind of hard. So they have it in the face and the hands and the feet. Non-diabetic hypoglycemia is when, like, I have hypoglycemia. If I get too hungry, my blood sugar drops on me. I start getting shaky and my heart starts flipping around. And so that's hypoglycemia. I am not a diabetic. hypopituitarism. This is a diminished secretion of the pituitary hormone. So this pan means all of the hormones. Okay, so they're hypo. Okay, then you've got pheochromocytoma, which is a benign tumor in the adrenal medulla. Okay, so the adrenal gland, remember on the outside of the adrenal gland, which sits on top of the kidney, is the cortex. Inside the adrenal gland is called the medulla. Then you have pituitary dwarfism, so that's self-explanatory. These next three, these are the symptoms of diabetes. The 3 P's: polydipsia, polyphagia, and polyuria. Know those. Precocious puberty is these young children, say about 3. I would guess around 3 years of age. They start developing. So the girls will start developing breast and maybe even some hair. And they also start getting, having sexual tendencies. But emotionally, they're not there. They're young. They're still at the age of 3, but yet they look older. And this gets to be a problem when these children are like in junior high, maybe later part of elementary school and junior high, because the kids think they're older, and even the older boys will start taking advances on them. And it is sad. It really is. They're not ready for it. Retinopathy is a disease, an eye disease caused from diabetes, and the sugar gets around the retina and it deteriorates the retina. Thyroid toxicosis is a severe episode of worsening symptoms of hyperthyroidism. So this is really bad. When the thyroid gets really out of normal range, it can cause arrhythmias, so bad that people think they're having a heart attack and they have to go to the hospital. We have some diagnostic tests that the fasting blood glucose. Now, the FBG. This is a fasting test, and usually they will say fast after midnight. So this is, they take blood from a vein. It's not the finger stick. It is through the vein. And it's also called the fasting blood sugar, FBS, okay? But I don't want you getting it mixed up with the finger stick, okay? You've got the finger stick blood sugar or glucose, FSBS or FSBG. And this is still fasting, but it has to be from your finger. The glycosylated hemoglobin, which is easier said to, it's easier to say, the hemoglobin A1C, HbA1c. This is for the doctor will do this test on you to see if you are if you have that possibility of becoming diabetic. So the range is like from 0 to 6, and from above 6 is that you've got more of a chance of becoming diabetic. And what they'll do too is for diabetics to have this test done every few months and to see if they're improving with their diabetes. They try to get their A1s and by short they call it A1C. That they try to get it down below 7, but that still means they have diabetes, but they've improved, and hopefully they could get off their medication and control it by diet. The other one I want you to know about is a thyroid function test, and this is a blood test, and they also call it a thyroid panel. And so you've got the thyroid stimulating hormone, the TSH. You have the triiodothyronine, which is the T3, and remember about it shows that it's the tri is in front of that test, and thyroxine, which is T4. So know that the T3 is a triiodothyronine, and the other one, the T4, is a thyroxine. But these make up the thyroid panel. So if the doctor palpates your throat to see if your thyroid is enlarged, if it is enlarged, they're going to do a scan on you to see what's going on in there. The thyroid stimulating hormone, TSH, is a measure of the ability of the thyroid gland. So this is to see about how the iodine is what is secreted through the hormone. The TSH would be part of the thyroid profile also. On your endocrine map that you have in the PowerPoint, it's got all of these, the organs, the hormones they secrete, and I want you to write the abbreviations beside them. And it's also got what the function is, okay? So know those. Your abbreviations, you will see those in your pathology, but the ADH is the antidiuretic hormone. We went through that. That's on your map. The BMI is, we look at that for the body mass index to see if you can be classified as overweight or obese. BMR, basic metabolic rate. Now, on your calcium and cancer, make sure you know that calcium is uppercase C, little a, and the cancer is uppercase C, uppercase A. Know those two differences. The DI, we talked about the diabetes insipidus. That's the urine, not diabetes now. It has nothing to do with diabetes. DKA, we talked about that. Diabetes, DM, we talked about that. We talked about your blood sugar, growth hormone. Glucose tolerance test is they want to check and see if you are diabetic, and that's a 4-hour test. It's wicked. HRT is hormone replacement therapy, and it's any type of hormone now. We hear it as like with Premarin, which is like an estrogen hormone. So we hear that mostly, but this is any hormone. Insulin-dependent diabetes mellitus is if they are on insulin. Now, potassium, remember that your root word for hyperkalemia, that is Kali, that is potassium, Kali. And your symbol for potassium is K. Then for sodium, you've got hypernatremia, natri, N-A-T-R, and that is sodium. So your element for that is Na, sodium. Then PTH, parathyroid hormone, we went through that. We went through your T3 and T4 and TSH. So that is it on your lecture. Go through this, use your PowerPoint, make notes so that you know these hormones. You've got to know that map, okay? Know those abbreviations. If you know your PowerPoint, you will do well on the test. So good luck, okay? And I'm sorry I didn't get to see you this week. Talk to you soon.